Here we go. All right, everybody, welcome to another edition of the NIDA Connections video series. My name is Gabe Gavito. I am the volunteer program supervisor at NIDA, and today I am joined with Ilene Fishman. Ilene Fishman has maintained the general psychotherapy practice with a specialization in the treatment of eating disorders for 35 years. After graduating from the NYU School of Social Work, Ilene trained and was on staff at the Center for the Study of Anorexia and Bulimia, also known as CSAB, and is currently a supervisor there. While serving on the national board for the American Anorexia and Bulimia Association, Ilene helped found the National Eating Disorders Association. Ilene currently serves on its executive board of directors and has remained active in NIDA since its formation as a clinical advisor. Ilene is in private practice in New York City and Montclair, New Jersey, and speaks widely as an expert on the subject of eating disorders across numerous multimedia platforms. Look for her upcoming book, The Deeper Fix. Ilene, thank you so much for joining with me today.
Thank you, Gabe. It's a pleasure to be with you, and I'm so glad that we're doing this.
Absolutely. So for the theme of our talk today, we're talking about coping with loss during COVID-19. So this is a pressing issue for everyone within our community, around the country, and around the globe. So I guess we could talk about understanding what does loss mean in a time like this.
Usually when we talk about our loss support network with NIDA, and we talk about loss, we talk about literally losing someone with an eating disorder. We talk about all the different losses that are associated with eating disorder, time, aspects of life, resources. So loss is a huge issue with anyone struggling with an eating disorder. And now with COVID, we are all experiencing loss in different ways. It is a time of loss for everyone, which can be both feel helpful for people who are dealing with loss associated with an eating disorder, or it can also feel frustrating because, how do we measure loss? Everybody is struggling right now. And it's always dangerous to measure loss because there's no way to say who is struggling worse or who is struggling or suffering more. But loss with an eating disorder is really legitimate.
Yeah, definitely. And I think to what you're mentioning, in this sort of situation, in this unprecedented situation, we're all reacting to loss in a different way. So how can we cope, or how do our coping strategies change in terms of the way we grieve in such a situation like this?
Well, first I want to say that in terms of loss, and then I'll answer that question more directly, Gabe. We've all lost our routine, and we've all lost our schedule, and we've all lost how we meet with people live. So how do we, for people who are struggling with an eating disorder who have a treatment team, we can't meet with our treatment team live. For people who like to particularly exercise in a certain way, can't exercise in the ways that we used to. We can't get our food the ways that we used to. So there are specific losses for someone who's struggling with an eating disorder.
Yeah,
and I think acknowledging those losses head on, not trying to deny them, not trying to minimize them, and not being afraid to feel all the feelings associated with loss and with grief. I truly, truly believe this. I will always say that it is much more dangerous when we try to repress our feelings and our emotions, even the most painful feelings, the most scary feelings. It's more dangerous when we repress our feelings, because that's when we end up with all kinds of symptomatology. That's when we develop eating disorders, or we develop OCD, or we develop, we have trouble sleeping, or it comes out in some way. There's no way to avoid grief. There's no way to avoid painful feelings. So being able to lean into them, trust ourselves, we build the muscle of, I can feel my feelings, I can feel my pain. It's not going to be bigger than I am. I can rise to this. We don't get to always choose how we're challenged, but we can choose how we rise. And rising to grief and pain and suffering we can grow a lot. It is an opportunity for growth.
So Ilene, I think based on what you're saying and how I'm interpreting it, now more than ever, we need to make sure that we're getting support for ourselves and that we're supporting those in our lives who are affected now more than ever in this situation, especially with the limitations that you mentioned earlier in the way that we're accessing support.
Right.
Um, can you tell me a little bit about how somebody could support a loved one who's experiencing loss during this pandemic?
I think compassion, patience, we're ourselves, again, all suffering and struggling and being challenged. And then how do we stretch ourselves to support our loved ones who are being challenged and suffering in different ways? It's easy to feel even more impatient, or shall I say the other way, it's harder sometimes to have as much compassion as we want and generosity, even emotionally, because we're ourselves struggling. So I think being aware of that is important. I am meeting families, and I'm doing all my work telemedicine, so I'm seeing patients remotely, and I'm meeting families. And so that's a way, ask to get involved with your loved one's therapy. If they're not seeing a therapist, find a therapist. Now is the time, and it really is a great opportunity. It's super challenging for families to be back together. Kids who were in college, who have been thrust out of college and thrust back home, families who were living more independently and now have their grown children home. Again, some of the many, many numerous challenges. But it is a time that if you want to get involved with professional help together, in some ways it's easier than ever. It's not as ideal as meeting in person, but in some ways you can do it more easily. So ask to get involved with your loved one's therapy if they're in therapy. And maybe you can be included in those sessions somehow.
Those are some really great suggestions, especially now that we live in a time where technology is, even though we can't physically go to therapy or go with a loved one to therapy, or if there were geographical barriers prior to this, the fact that now families and friends and loved ones can still be supportive with somebody who's struggling with an eating disorder by joining them in teletherapy, which, as you were mentioning, it's not the same as being in person, but it's still support. It's still available. I think that's certainly something that has been probably beneficial since the start of this outbreak. Now, Ilene, can you talk a little bit about the effect that loss can have on somebody who is actively struggling with an eating disorder in this given situation?
It can really make things that much harder. People who were making progress and felt like they had a handle on things are, sometimes can feel regressed. They can sometimes feel, and then it can be anger that they're doing so well, they've been working so hard, and then they had certain things in place, and now all of a sudden everything's sort of, thrown up in the air. So that can be very, very difficult. People who weren't doing so well, who were struggling, could be struggling even more. It's even more challenging. People who maybe were considering higher level of care, which would be, say, a partial hospital or an intensive outpatient or even residential level of care, right now that's challenged because although some programs are functioning, it's not the same in this time of coronavirus. So that makes it really, really hard. And again, there are the same challenges that we had before and new challenges on top of it. So get help. Reach out for whatever help and support. There are support groups. There's lots of stuff you can do online. You can meet with your dietitians online. You can, you can meet with even exercise people who specialize in eating disorders. There's all kinds of ways to get support remotely.
That's great. Just to add on to that, with Anita, we have an abundance of resources available on our website. We have a section specifically tailored, focusing on COVID-19 resources for people who may be affected. Our national helpline is fully operational for those who are seeking help and support for their eating disorder during this time. We also do have additional resources for those who may be in crisis situations. So if anyone is in a crisis situation, you can go ahead and text NITA to 741-741. But I definitely think the advice, the suggestions that you're given, that resources are available and to like seek them out. They are there. They're waiting for you, is a very important message, especially in such a time of uncertainty where there's no guidebook on how to navigate through this. We're all navigating through it together in our own way. We're all experiencing loss in our own unique way. But the commonality is that we're all affected by this in one way or another. So, I mean, Ilene, do you have any like last message, parting message as we continue to navigate through this?
Well, I would say loss ripples out too. And one of the things that I have noticed with my own challenges during this time is that sometimes I feel like I can't even wrap my head around it. Like
Mm.
it's so big. The concerns, the worries, the loss, the impact, the potential impact, it just ripples out and out and out. It's so big. Again, it's super, super challenging. I wanted to also mention that for those of us who have lost loved ones, this is a time when we are struggling, when we are feeling a lot of pain, when we're maybe not as distracted. Some of our coping strategies of distraction we don't have right now. So we may feel as though we've gone further with our grieving process, that we're further along, and then all of a sudden we notice that we're in more pain again, or the grief comes back. Because in times of crisis, that's what happens. Sometimes unprocessed grief comes to the surface. So that can feel very overwhelming and threatening. But again, please think of it as an opportunity, that it means that, okay, there's more that we've been keeping inside of us. It's coming to the surface. Let's deal with it head on. Let's feel it. Let's work with it. Let's work with our grief. But don't be surprised if old painful stuff that you thought, again, you had moved beyond, comes up right now. Stuff is going to get brought up. It's going to, everything is, again, sort of up in the air and stirred up for us. Big challenges.
Fantastic. Well, Ilene, I do want to thank you so much for joining with me today. It was really great speaking with you again. It's always
Thank you
a
for
pleasure.
having me.
Of course, and just as a reminder to everyone that's watching, you can contact our national helpline by calling our toll-free number at 800-931-2237, or by contacting us through our click-to-chat service on our website. If you are looking for peer-based online support, whether related to your eating disorder or eating concerns, or if COVID-19 is affecting you, you can visit our online forums for online peer-based support from the community that's on there. And again, if you're in a crisis situation, you can text NITA to 741-741. And you can watch the rest of the Nita Connection video series on our website. They're all recorded and uploaded on there, so please definitely take a look at them.
Thank you, Gabe. Thank you, Nita. And good luck, everyone. Be well.
Take care.